Hey Al, Cohen here. So I am back to do my surgery update video, which I know is kind of late. I wanted to do it sooner. Obviously, I had posted a mental health related video not too long ago. So if you wanted to, you can go check out that, and that will explain and kind of give you an idea as to why I wasn't able or in the mindset to do a post-op video in full. So this will be me explaining what happened during my surgery, what's going on now, um, a little bit of what happened in between now and when I came home, and anything else that I can think of. So, I officially, yesterday, Trans Day of Remembrance, very important day. Bimbrook Pride, I'm head of Bimbrook Pride. We actually held a Trans Day of Remembrance event called Our Past Gave Us a Future. We had speakers, and some of those were poets. We had a rapper. We also had Tim Hortons in Bimbrook donate snacks, and we had free coffee, tea, water, and hot chocolate. And then we also, the venue that we were at, which is a golf and country club, had the bar open so that if anybody wanted alcoholic or non-alcoholic drinks, they would be free to order those as well. That went off great. So I just wanted to mention that, but it was also interesting because yesterday was also my 1 month post-op. So on October 20th, I had my phalloplasty surgery, and as of yesterday, November 20th, I am a month post-op. So while I was in Austin for the week recovering, I really didn't have any issues. I did end up having a hematoma on the right side of my scrotum, and that ended up scabbing while I was there. And they weren't worried about it. They sent me home and said just keep an eye on it and update them with pictures. I had the catheter bag. When I was there, I had the bigger bag, and then at my post-op appointment, when I went in and they checked to make sure that I was clear to go home, they switched me to a flip flow, which is where they'll take the bag and that big long hose off of it, and where you have the tube that attaches to the bag hose, they give you a little valve, and literally it's just a little tube at the end that connects on to the catheter tube, and you flip it one way and urine will be able to come out from your bladder, and if you flip it the other way it closes. So that's what I was able to go home with. They also gave me a catheter bag that could be attached to your leg, but I'm 5'4", and the hoses for those bags are almost as tall as me, so I have to like coil them, and then that just becomes like irritating. So if I'm walking or whatever, they kind of have to get coiled, and then urine collects in it, and it's just like not fun. So I was really glad that I got the flip flow so I didn't have to travel with a catheter bag on. Came home. While I was in Austin, I felt great. Usually, I've found that the first week post op, like maybe the first day or two, you might be like reasonably uncomfortable, depending on what stage you ended up getting. And so, the first week there, I felt quite good actually, and I found that my other surgeries, the week that I stayed there right after my surgery, I did feel really good. But then obviously traveling home and then getting home, it's really like kind of like the second week where you get a bit of a wave of like uncomfortability. And that also, if you have a catheter, that's going to be something that will increase uncomfortability, or be your cause of uncomfortability. That was what happened with me, which I will explain in a moment. I do want to talk about what happened during my surgery, but I also wanted to like explain the difference between like 1 week post-op and 2 weeks post-op so that you kind of understand where I'm coming from when I start to get further. But so when I went in previously, so that was my 6th surgery. My first stage was to create my phallus and to put a graft over the area, a skin graft over the area that they took to make my phallus. I had urethral lengthening done, and I had my scrotum closed up. So I had my scrotum made and then closed up. And what else? I think that's all I had in stage one. Obviously, nerve hookup as well, so that you have sensation. But that's what I had during stage one. And unfortunately, before I left, I started off in San Francisco. If you've watched my other videos, with Crane Center as well. My doctor was Dr. Safer. Unfortunately, I ended up with a fistula quite large at the base of my phallus, probably about a good at least an inch big, due to sutures popping too soon. I have a weird reaction to dissolvable sutures, and unfortunately, that's mainly what they use. So for me, those are something that aren't really fun. They either pop too soon or my body heals before they can dissolve out, and then I end up with almost what is like a pimple because you are trying to push out that material that has dissolved, kind of. So that also is something that I have had recurrently throughout my surgeries, is having to deal with the sutures getting stuck inside my skin because my body heals faster than the sutures are wanting to dissolve. So that was my stage one. And I had the fistula, which is quite literally a hole in my urethra. And then I had the urethral lengthening, so I was supposed to be able to pee out of my penis, stage one. However, due to the fistula and whatever else, my urethra healed itself closed. So I was not going to be able to stand up to pee. I then, the day before I went home for surgery, because the fistula was so large, I went in for a quick surgery to have that stitched up more so that it wasn't as big, and so that it would not continue to get bigger. Then I went home, recovered for 6 months, and the next stage wouldn't be like it would be for everybody else, where it'd be testicular implants or glandsplasty or something like that. What I had to have done was, I had glandsplasty done second stage, but I also had to have a Johansson done, which, for those of you that don't know, it's where, because my urethra closed, so my phallus was taken, and it was, so we'll say that, like, just assume this is my phallus, or I'm trying to figure out, I don't have either. So think of a cylinder or a phallus, and underneath my phallus, they had to make incisions, and then they took grafts from my hips that were about like half an inch wide, and they laid them inside there so that it would create my new urethra. Now, my body likes to heal fast, like I said before, and sometimes that could be an issue instead of a good thing. And so what ended up happening was that those grafts ended up healing quite small, and they were not going to be wide enough to make my urethra. My glandsplasty ended up going well, but when I came home, I started to get necrosis, and my GP here, I was told by my surgeon to go to the GP's office and tell them that the necrotic skin just needed to be removed, and then I needed to care for the wound itself by going to wound care. And my GP had no idea, didn't suggest the hospital, didn't suggest wound care or anything. I had to suggest wound care after the fact. But the only option that they wanted to give me was to send me to Montreal, and there was a reason why I didn't choose Montreal for where I went for my surgery and why I left the country. So I told them that that was not an option, and I was not going to drive all the way to Montreal because I would not allow them to touch me. So what ended up happening was I talked to my doctor, or my surgeon again, and they kind of explained it so that I could explain it maybe to my doctor again, but I figured it wasn't going to work out, so I ended up removing the necrotic skin myself, and then I ended up going to wound care and having them help me out. I recovered for 6 months, went back because I had to have a Johansson done again. And at that point, I had already been dealing with really bad pains, kind of like just behind where my scrotum is. Oh, stage one also, the stitches came out of my sewed up scrotum. So my scrotum was not closed. It came back open. So in the Johansson stage one, they closed up my fistula a little bit more and moved it back. So I was actually urinating from where my kind of just north of where my old parts used to be. So it was kind of like having mini parts. I've talked about it before in other videos if you want to go check that out. But anyways, I went back and had another Johansson done. And I'd been in so much pain from that area and didn't know why. And when I went in for surgery, Dr. Crane did a cystoscopy, which is where they send a camera through your urethra to see what's going on in your urethra and your bladder and things like that. And I ended up finding out that I had a bladder stone the size of a duck, possibly goose egg. So that had been there for a while, and even though the pains I had been complaining of should have been picked up by a GP as possible kidney stones or something to do with my bladder, they kind of just ignored it and assumed that it was just like a urinary tract infection or just irritation from my surgery, and only focused on the fact that I had trans surgeries done recently, so that must be the common denominator, and that's the problem. So that surgery, they couldn't do everything that they wanted to do, and also they had to lay more grafts, so my penis had to be opened up again and laid more grafts. And then I ended up going home. I went to wound care to make sure that everything was taken care of appropriately and things like that, just so that no risk of infection and other things of that nature. Went pretty well, like a few minor complications to do again with stitches or things like just certain areas where the skin looked a little iffy, but it was one of those because I was in wound care, I had the proper things to take care of it so it didn't become an issue. Then I healed for 6 months, and then I went back for surgery, and I had to have another Johansson done. And this time they took even bigger pieces from me, and they took one from my thigh just above where my donor site is. And unfortunately, when I came home, due to the weight of that area and the incision and how sutures end up popping on me, the incision actually opened up, and I've made a video about it. I had to go to the hospital. I got sent to wound care again, and I had to actually have wound vacuums on for a couple months. That area is all healed up, but it literally opened up right down to like almost muscle. So that was a very scary thing to have happen. However, it's all healed up, and it's all good now. I didn't really have too many complications with that. I did have an area where for some reason I had some ingrown hairs that decided to pop up out of nowhere and cause my penis to swell quite a bit. And at the end of it, it just had to like release itself. So it did come out, and I did have a little wound that I did have to go to wound care still to take care of, just to make sure it closed up properly, because my next stage that I went back for would be where they would close up my phallus and make my urethra. I know, it sounds like my biggest worry was going back there and thinking that I wouldn't be able to have it done. So we're at 5 surgeries, and then come to this October, I went back, and before I went in for surgery, we discussed everything. I was going to have my phallus closed, so because they laid those grafts, then they would be able to take my phallus and roll it and then stitch it back together underneath, and that would be my urethra in there. And because the skin had already healed and everything, it should not at all close back up. Then they closed up the area where I was originally peeing from, but in where my scrotum should have been closed up. They then closed my scrotum and put in testicular implants. And from there, I woke up and everything was great. Like I said, my post-op, I had a hematoma, but they weren't worried about it, and I wasn't too much either. So now we're getting to the point where I'm back home now, and I've had my catheter for just over a week. It's starting to get really irritating. At this point, parts of the scab on that came from the hematoma were starting to come off, which was a good thing because you don't want it to stay on there too long. It becomes Eshlar, which is a very thick scab, and then could take away layers of skin and have that area be not as thick as the rest and have it be thinning a little bit. So I ended up booking myself into wound care so that I could go back. I decided last surgery, the fifth surgery, to make sure that I was seeing the same wound care specialist every time so that we were on the same page. We knew everything that was going on, and I wasn't being, how I was treating things wasn't going to be changed because I saw a different nurse or something like that. So when I came back, I went for the hematoma, and just before I went, I had some stitches pop, which caused an area at the base of my phallus to open, creating a fistula. So I had a small fistula about this big, maybe like I'd say like maybe a quarter of an inch. And so I had sent pictures to my surgeon's office and I update them on the regular, and they weren't overly worried about it. They said that's something that should close over time. You're just going to have to make sure that when you go to the bathroom, when your catheter comes out and you're starting to try to pee from your penis, that you cover that hole and try your best to make sure that all the urine comes out of there, because then you're making it so that it's doing that, and then it will also keep the fistula dry and from having urine constantly coming out of it, and it will be able to close and heal quicker. So not overly a big deal. Like, it got to me a lot because I was hoping that I was going to have that moment where I stood to pee and I was so elated by it and euphoric about it that I would cry. And when I tried to pee before my catheter came out, most of the pee was coming out of the fistula. I ended up crying because it was so dysphoric and it was so upsetting. So that was a big source of things, and being the first week of being home, it just felt like I'm gonna have to go back again. I'm gonna have to this, I'm gonna have to that. What if this, what if that? And I was just so unaware of what to do and what to think, and, in my own head. But it's now a month later from my surgery date, 2 weeks later than when I pulled my catheter out. I did try to go see a urologist that I have. I was supposed to make an appointment, but the week that I called, they were out of office for the week. I called my doctor's office, and they said they didn't have anybody to do it because it ended up being on a Friday that I got excruciating pain. It was 10 out of 10 pain, and I have a really good pain tolerance. So I ended up calling my doctor's office, and nobody was there. I called the after hours clinic as well, and they said nobody could do it, that my only option was the ER. So I called the urologist's office back because there are a few urologists that work at St. Joe's. So I asked if anybody could pull my catheter for me, and they said no. And if it was that bad, I needed to go to the ER, which go back to stage 1 videos, and my ordeal with catheter removal was quite traumatic. So I was not thrilled to be told to go to the ER for a catheter removal. So I had talked to Crane's office, and they had also given me information about how to pull your own catheter. So I tried to wait the whole weekend until the Monday so that I could get a medical professional to do it. However, late on Sunday night, it was just too much, and pretty much at midnight, I ended up going into my bathroom and pulling my catheter myself. It doesn't take long. It takes a few seconds. It wasn't a big deal or anything. I felt relief instantly, and I felt better a lot within like 3 days. However, thinking about what you've had done with your urethra, with your bladder, with this and that, the thought of pulling something out like that is quite daunting and scary. So that was a lot of my also where mentally I was, because it was this constant thing. I was on bladder spasm medication, I had pain meds, and then I got put on a bladder spasm medication that's literally supposed to pretty much paralyze your bladder, which none of those worked. So I ended up doing it myself, and then I felt relief, and it got better every day, and now I don't, like, obviously no bladder pains after a couple days. Don't really have much pain, to be honest. There have been a few areas where these stitches have decided to pop out, and then that area hurts a little bit for like a day until the skin's kind of like calmed down. But other than that, most things have been going really well. I did have a stitch that ended up, it was very, very knotted many times. They tied it many times, and that ended up kind of like being pulled into skin and created a little like tiny just like wound. So that's towards the tip of my phallus, but that is healing up and it's fine. Like, I'm not worried about it. My fistula at this point in time is maybe like literally just a tiny, tiny little hole. So I have a little bit more of it to close up before it's completely healed shut. So cross your fingers for me. I'm knocking on wood. And the area where the scab was, literally a week after I had seen the wound care specialist, it was gone. It came off on its own, and I've been treating that, and it's getting better and better. The skin obviously has to regrow, and like stuff has to come off. It's still healing and creating new skin cells, but it's gonna be all good. So I'm quite happy with my progress considering the little bumps in the road. I know I've had quite a few, and that's very daunting and scary. And some people could think, well, I'm not going to get the surgery that I wanted because this guy said this. I don't regret it. I don't regret doing it at all. And yeah, I had quite a few complications, but at the end of the day, I had minor complications that I've been lucky to like bypass. And in the moment, it is literally one of the scariest things you'll go through when you have a complication, but you're not thinking about things realistically because this is something that you've never been through and people don't really talk about or educate. When you literally would have to sit down and think of every question imaginable to try to ask your surgeon. But at the end of the day, like, you literally, it's just you're in the mode of where like you've been through so much and now you have a complication, and it's very traumatizing. It really is. So at the end of the day, yeah, I went through a lot mentally, and I've been through a lot mentally with the surgeries and complications, but I do not regret my decision. I do not sit here and go, I really wish I did this differently. The only thing I think I can say is that you were never really prepared, and I do wish I was more mentally prepared. However, it's so different for each person, each surgery, each surgeon, when you're thinking about it, that you can't be completely prepared. So thinking that you're completely prepared sometimes is just not even within the realm of possibilities. So you just have to be as prepared as you can and go in knowing about the risks, about the complications, which I did, and just make sure that you are aware of yourself and where your state of mind is. That's the most important, because it will take a toll on you. You will not go through this surgery and not have moments where you are depressed or you are down. That doesn't mean that it lasts forever, though, and that doesn't mean that it's going to control your life. It just means that there's going to be, it's difficult. You have to expect that going through this is going to be incredibly difficult on your body and on your mind. And your feelings, man, your feelings. You feel like you don't know anybody who understands it. You don't have any clue who to talk to. Luckily for me, in the beginning, I had a couple people that I could talk to. However, they've been post-op for quite a while now, so sometimes they don't remember certain things or didn't experience them the same way I did. However, the last couple surgeries that I have had, there have been a few people that I've made friends with, and I've been very grateful to be able to talk to them. And also to Crane's office, Parker, Judah, all the staff there, everybody in Austin and in San Francisco has been amazing. I've never been left hanging. I've never been treated terribly by them. They've always been there for me and had my back, even as far as having the surgeon's personal phone numbers. It's that, if I need anything, I can contact them. And between them and my wound care, like, it's really the best care that I think I could get, because my GP's office is not, even though it has the positive space and we do treat trans patients, as far as bottom surgery goes, especially for trans males, they don't know anything. So they're going to send you somewhere else to get dealt with. I found wound care, at least in Hamilton, was very helpful. There were actually quite a few nurses that have treated trans patients before, so that was very interesting. We had great talks, and they were very respectful. So from here, I'm just going to let you guys know what I do basically for my wound care right now. So when I am cleaning the areas, what I have, so when I'm getting ready after a shower or a dressing change during the day, I have these, they are called QD swabs. So this is what these are, and when you take them out, there's a little Q-tip type sponge on the end that has rubbing alcohol on it. Now, I take this, and for argument's sake, we will say that this is my phallus. It is not this thick anymore because I also got lipo the last stage, and I got lipo a couple stages as well, but like I said, view my other videos for what exactly happened in those. So underneath my phallus here, I do have the little wound from the stitch, so like I'll clean that, and then my fistula is right about here, so then I'll clean that right there, and then where my scrotum is, so scrotum, let's figure it out. Okay, so here, one side, two side, okay? So one side is all good. The other side, right along here and on the inside right here is where I had a hematoma. And so that became a scab. And then it came off and now there's new skin. So in here a little bit, there's a little bit of a divot. It's not open. My implants are not going to come out. It's pretty superficial. But right here and then over to about here is new skin that is growing. So what I do is I take this and I wipe here and then a little bit inside here, and I make sure to get on that side as well, just in case there's any, because it's a moist area, you do have to make sure it does stay dry, and that's not always doable. People sweat, things happen, wounds weep, so this helps with cleaning. After I finish that, I have these iodine swabs, and all I do is I dab the top area with the swab, and then I dab the area where my fistula is, and then in my scrotum, I dab the inside here, not this side because this skin has nothing wrong with it. So I dab right in here and then right on there, just where the skin's regrowing. This helps to keep it dry and not so moist. Then what I do is, not every day, but usually every other day, I take a little bit of Medi honey and I put Medi honey on the little spot here. I'm not putting it on my fistula just because it's been going well. Where stitches have come out and there's been a little bit of like bleeding, I put a little bit just so it goes away super fast because this stuff works really well. And then on my scrotum, I'll put it just in here on this side and just here, just like where I cleaned it. And then what I have, this is Tegaderm. So I take a piece like this and I just put it right like that over my scrotum. And then what I do, this is called Curlix. It's gauze. So what I do is I take a piece that's about as from my enough material to get from the tip of my phallus to underneath my scrotum. So roughly about that much or so. And so it's folded in half, and then I would cut it here. And then what I would do is, now this is going to be my phallus just for argument's sake, but I would take my phallus like this and wrap it, and then the back end of this would come right to like cradle my scrotum. And then I've shown you I think I've shown you guys all of this before, but this is Surgilast, and I use this. You can stretch it pretty wide. This one is a size 4, and so what you would do is slip that over the phallus, and then it holds all this dressing in place, so you're not having to tape it, because I found when I was taping my dressings, the tape wouldn't hold, and I didn't want to tape to my body, so it would constantly slide off, and that is a big pain in the butt, because every time you take your underwear off, or even when you're walking too much, your bandages would start to slide off. So I highly recommend this. It's really awesome. Yeah, and so that's how I take care of my wounds right now. hopefully the fistula will be closed soon, and then my scrotum will be healing up, hopefully before the new year, and I can stand to pee. I do have to hold the fistula. Right now I'm preferring to sit to pee. I do have to push underneath my balls a little bit to get the rest of the urine out, because the way that a female urethra, where it stops and then where the hookup would be for you to make the rest of the urethra for urethral lengthening for a phallus, it's not the same flow or angle as a cis male's urethra. So sometimes you could have urine collect, and even in cis men sometimes urine can collect a little bit in the urethra, so that's why like you shake it, or sometimes you just push up on your balls a little bit and it will get the rest out, so that you're not like gonna end up leaking later on in the day, or having that spot on your pants and being like, oh great, I forgot to shake, or I guess I wasn't done, or something like that. But so far so good. And I do want to put up a video when I can stand to pee without holding on to the fistula. So that will probably be one of my next updates, but I wanted to give everybody a little bit of an update on what I had done, how it went, and where I am right now and how I'm caring for myself. So if you have any questions, or I left anything out that you think that I should have said, or if there was something I said I was going to explain in the beginning of the video that I didn't explain or touch on, please comment below. Otherwise, I will see you guys soon, and I hope that everybody has a great week. Talk to you later. Peace.